I'm Mrs. Robertson, and I also help with the skills. And we're going to go ahead and start with this dressing change, and this is first intention healing. Go ahead and you might refer to the first video I did on as far as checking doctor's orders, checking your supplies, and GIing the patient. So I'm just going to go ahead, all that has been done, and I'm going to start in on the wound care. I'm going to go ahead and wash my hands, and I've already, like I said, checked the allergies. As far as the wound care, this is just going to be wound care with saline to clean the wound, and it's also going to be just a basic dressing change with the 4x4s and an ABD. As far as knowing what type of drainage is from the wound, you could probably get that off the previous nurse's notes. So I'm going to go ahead and glove so that I can take the old dressing off. These are just wall gloves. This part is not sterile, so we'll just use the wall gloves. I would, because of all dressings, you're going to take the dressing, pull it up, and not expose it straight to the patient. A lot of times it's because of the odor. Before we even do this, again, you would ask the patient if they had pain, so in case you need to pre-medicate them before you do the dressing. Okay, so what we're going to do, we're going to go ahead and remove all the tape, holding the tissue down as you remove it. Once you've got it loosened, you're going to pick up the dressing and you're going to pull it away from the patient so you can look at it. Once you do that, you can look at the dressing. As you can tell, this has sterile drainage. It looks kind of bloody. It's not that much. I would consider it a small amount. You would want to also document if there was odor to this, and also like the previous dressing or video, you would want to make sure on the wound what it looks like. You're going to look for approximation. This has staples, so you're going to make sure that they're approximated and intact. On that wound, once you look at it, you're also going to look to make sure that if there's erythema, which is redness, if there's swelling around the tissue, and what the wound bed looks like itself. What you're going to do then is you're going to put all your dressing in your glove. You're going to pull your glove over the dressing as before and put this in. Okay. When you get through, there is a trash can here. It doesn't have to be a biohazard. This is not cultured. It's a closed wound, and we're going to go ahead and just drop it in the trash can. Okay, now I'm going to wash my hands again. And when I'm through washing my hands, I'm going to go ahead and open up my supplies so I can access them easily, because once I glove, I won't be able to open them. So I'm going to go ahead, and as I said before, you have to look at the expiration and the date when this was open, within 24 to 48. I'm going to go ahead and lip it. So I'm going to go ahead and take the lid off, put it there, and when you lip, you're going to have the label in the palm. Once you lip, then you're through. You can set this back over here, okay? And then you can recap later. If you want to, you can put the lid back on, but it's just as easy to leave it off. That way you don't have to worry about removing it. Now, as we've done before, you're going to make sure that all your dressing is sealed and that it's within the expiration. So we're going to pull back, pull away from you. And I'm going to go ahead and not open this one, because as you can tell, the wound itself is not that bad or draining, so we won't need all 10. I'm going to go ahead and open my ABD, if I can get the corner, and loosen it, and then I'm going to open it away from it. Okay, once I do that, I have a sterile area right here. I'm going to go ahead in a minute when I glove and take 2 out and leave there so I can put it underneath my ABD. First thing I'm going to do is wash my hands. Now I'm going to open up my gloves. And I'm going to pull this out, and I'm going to put this. Okay, so I'm going to pick up by the sleeve, and I'm going to go ahead, put this on. Now, before I even start to put my glove on, I need to go ahead and put my, saturate some of my gauze. I'm going to go ahead and take 2 of my 4x4s, like I said before. If I can measure 2, there's 2. And I'm going to lay them right here on top of my ABD. Now I'm going to go ahead and take my saline, and I've got the label in my palm. And I'm going to go ahead and I'm going to wet, never crossing over the field this way, but this way. Okay. Once I'm through, I can set it back here. Now I'm going to put my other glove on. Getting the thumb out and placing your thumb in. Okay. Now I can get into my field. I'm going to go ahead and separate them out so I can take this hand and put it in this hand. Okay. So I can kind of have them apart when I get ready to pick up. You don't want to move them too much outside the tray because of the possibility of contamination. And you've got to stay within your tray. So that should be enough, okay? The wound itself, you may have to use all of the dressings, and this is a habit I have. I just normally put my hands somewhere where I can kind of keep them visualizing so I don't contaminate. So I'm going to take this one with the saline, and we're going to do the wound bed itself. And like you did the other wound, we're going to go from the top, and we're going to do a circular motion all the way down. Once we're through, we're going to discard. We're going to go to this hand without touching it. We're going to go to the top, and we're going to do a circular motion down. If the wound bed is really, really gunky and you feel like you need to do it again, you can go ahead and go again down the wound bed. If it's like this wound and it's clean, it looks intact, there's not much drainage at all, then you can now go to the outside of the wound and you clean down. And then you go furthest from the outside, the furthest away, down. Then you're going to go over here. That's why it's easier to separate before you get them. And you're going to go next to it, down. And then one more. If you happen to have some at the bottom that are dry, which this one is kind of dry at the very bottom, you can clean both sides with 2 different dry ones. Now you're ready for your 4x4s that go on top. And make sure it does not contaminate. Okay. Once you get it to this hand, you're just going to drop it. Don't try to replace it or anything, just drop it. And then drop, okay? Now you have your ABD with the blue side you're going to place up. You're going to turn it, and you're going to put it down. This ABCD didn't look quite long enough, but it is. Now you're going to window box it again. Some people do the one bottom, the middle, and the top. I guess because I'm so used to having bad wounds and they tend to fall out, especially if you're going to use the 2x2s on the chest wall the tape gives. So you can window box it or do it anyway. I tend to like the window box because it secures the dressing. And it keeps the 2x2s or the 4x4s, whatever you use, in place. And if you've already made your date and your name and your initials and all that for this patient, you can go ahead after you get through with boxing it. You can place it on your dressing. If you haven't, then you can also even put your date, time, and initial. And once you're through, you always ask your patient if they need pain medication. You go ahead and get them covered back up. And you go ahead and make sure they're in safe position. You go ahead and clean all your supplies. Get them all in the trash. Take your gloves off. Be sure and reseal this for another person. And we're going to use the side rails up and get it in low position and make sure the brakes are on. Always do a safety check. Make sure you document the same as with this wound as in the previous video. You want to make sure you document what was on the dressing, the soil dressing. You want to make sure that you document anything about odor, what kind of drainage, the color of the drainage, the amount of the drainage, how the patient tolerated it. You want to make sure how you did the wound care and all supplies used, and that patient tolerated it well, especially if you didn't have to medicate. If you have to medicate, you need to make sure you document that too. After that, make sure you leave the patient in a safe position and you double check. Thank you very much.